Well, experts now say that 4 out of every 10 cancer cases are actually preventable. But many people discover the cancer too late because they do not go for checkups. And this came out during today's activities to mark the World Cancer Day. Sharon Momanyi brings us this report.
Wanaumia sana. Hakuna matibabu yake ya bure. Watuonee tu huruma kama wale wagonjwa wengine.
Sionzile Mutinda's cry is just but one among those of scores of other cancer patients in Kenya who decry the cost of managing and accessing treatment for the disease.
Sadly, there are many people in our country who cannot afford to go for regular checkups such as mammograms, pap smears, and PSA tests. I would like to urge the public and private sector to work together to avail basic screening to Kenyans, especially in rural areas and informal settlements.
The cost of the disease is just but one of the problems. A crucial impediment in the fight against cancer in the country is late detection.
About 80% of reported cases of cancer in Kenya are diagnosed at advanced stages, when the treatment is costly and prognosis poor.
The Cabinet Secretary for Health, James Macharia, was speaking at the Cancer Day celebration in Eldoret town, where hundreds of people stood patiently in long queues in order to get screened for cancer. This was a gesture towards fighting the myth that cancer is a death sentence, which comes with no warning and no signs. Dr. Sipna Mwanzi, one of the few oncologists in the country, based at the Aga Khan Cancer Center, emphasizes the need for regular screening as a preventive measure.
The main problem is that the signs and symptoms sometimes mirror other clinical problems, so people don't realize the seriousness of the symptoms. And sometimes people think that these are normal things that are happening. So you get the cancer early, which means that the treatments are less, the treatments required may be potentially less, the cost to the patient is less, and you have a higher chance of cure for this patient.
Cancer prevalence in the country is at an alarming high. In 2013, 22,000 Kenyans succumbed to cancer, where 28,000 were diagnosed with the disease. Statistics indicate that over 40% of cancers in the country are preventable. Further, Kenya has only 10 cancer specialists against a global recommendation of 300 oncologists per population of 100,000.
My ministry, in collaboration with partners in both public and private sector, is in the process of improving the cancer prevention and control infrastructure and increasing the number of cancer specialists, which is currently very low and concentrated in the cities.
The cancer campaign this year aimed to dispel commonly held myths about the disease. It is clear that the major battlefield in the fight against cancer is the mind. It is crucial for all to recognize that a cancer diagnosis is not a life sentence. It is also crucial for all Kenyans to recognize the worrying trend of cancer prevalence and thus choose to live healthy lifestyles. Sharon Momanyi, KTN.